Massive changes are coming to Part D prescription drug coverage in the coming months and years, and if you are currently on Medicare or you will be going on Medicare in the near future, I will go over how these changes will impact you. For many Americans, prescription medications are the largest healthcare cost that they have every month, every year. Right now in July and August of 2023, many of you are possibly encountering the notorious donut hole, which I will cover here in a minute. Original Medicare does not cover prescription drugs, so people are left to find coverage through a Part D prescription drug plan. My entire career has been in healthcare, and how Part D coverage currently works is one of the most complicated topics that exist. So in this video, I'll explain how it works right now, how this is all changing in 2024, and how it is all changing again in 2025, because early signs indicate that this will be a huge benefit to people on high-cost medications. Okay, because there is a lot to cover, there are chapters in this video, so feel free to skip along as you see fit. So let's start with how prescription drug coverage works right now and has worked for the past several years. By the way, it is late July, early August 2023. Now, for most of your life, your medications were covered by an insurance plan through work or through the marketplace. Drug coverage was predictable in that you would have a set copay or coinsurance each and every month for the entire year. Well, if you are on a Part D plan, the number 4 is going to be important because you have 4 different phases of coverage that you are dealing with, each with its own copay or coinsurance that you are responsible for, which means that you could be experiencing a roller coaster of costs each and every time that you go to the pharmacy to fill a prescription. You should also be aware of 4 different payers when it comes to these costs. The first is you, the second is the insurance in the form of the Part D drug plan. The third is the drug manufacturers, the companies who actually make the medications, and the fourth is Medicare. I'm going to bring in a donut to help me explain both the phases and the payers. It'll make sense here in a minute. The first phase of Part D coverage is called the deductible phase. Remember that a deductible is the dollar amount that you must pay first before the insurance company is willing to help at all. You are the only payer in this phase. Now, Part D plans vary a lot, but the maximum deductible allowed for 2023 is $505. Some plans are lower, some have no deductible, but most standalone plans have some sort of a deductible, the maximum being $505. Another thing to note here is that some plans will cover certain types of medications even when you are in the deductible phase. This could be certain low-cost generics or other classifications, but this whole how Part D works conversation really matters for those on high-cost, usually brand or specialty medications, and how low-cost generics are covered isn't really the biggest issue. So let's take a common brand medication like Xarelto. The retail cost is right around $600 a month. You may find it a little bit higher or a little bit lower depending on your plan and pharmacy, but we'll call it $600 per month for this example. In the deductible phase, if you're on a plan with the maximum deductible, you are the only payer in this phase and you are responsible for the first $505. So in January, you pay the first $505, and since your deductible is satisfied, you now move into the next phase called the initial coverage phase. Now in the initial coverage phase, things work a little differently and more like what you're probably used to. You have a copay or a coinsurance amount that you pay each time that you fill that medication. In our example here with Xarelto, you're in the initial coverage phase on your first fill, so that difference between the $600 retail cost and the $505 deductible that you already paid will have a copay that is your responsibility. For this example, we'll say that the copay in the initial coverage phase is a $40 copay. Okay, month 1, January, you pay $505 for the deductible plus the $40 for the copay for a total of $545. You've satisfied the deductible phase and you're now in the initial coverage phase with that first copay. Month 2, February rolls around and you get that prescription filled again. Retail cost is again $600. You pay that copay of $40, so not so bad in February. January surprises everybody with that first month's payment of $545, but February and the next couple months are better. The payers here are you and your insurance company. Your responsibility can be up to 25% of the retail cost of that medication. This will all depend on the tier that your medication is on, whether that's generic or brand or specialty. So the max that you could see is a 25% coinsurance in this phase. In our Xarelto example, you'll notice that a $40 copay is about 6.6% of the retail cost of the medication. Your insurance company is taking care of the remaining 93.4% of that cost. Okay, so we're happy for now in the initial coverage phase. However, for some people, this happiness will change. In the back end, every month, as you are getting your medications, your plan is keeping track of the total dollars that were spent on not only this medication, but all of your medications. Month 1 was $600 for Xarelto, plus any other medications that you are taking. Month 2 is $600, plus any other medications. So once the total dollar amount adds up to the initial coverage threshold, which in 2023 is $4,660, you move out of initial coverage and into what's called the coverage gap. The coverage gap has another name, which you can quickly guess from our donut, the notorious donut hole. Using just Xarelto, you would meet $4,660 in about 7 or 8 months. If you have other medications, those costs will lower it to about 7 months or fewer. What this means for those of you watching in July is that guess what could be coming in August? This donut hole that we're about to talk about. While in the donut hole, you are now responsible for 25% of the retail cost of the medication. Remember that in initial coverage, 25% was the max that you would pay, and with Xarelto, you weren't even close to that. In the coverage gap or in the donut hole, you will be responsible for 25%, which in this case would be $150. So now you've had a month of $545 to pay, which was uncomfortable, but because you watched this video or others like it, you're at least prepared for it. You've had 6 months of $40 copays that you've had to pay, and you got used to that. You were comfortable with that. And then August comes around and now you're paying $150 every month that you fill that prescription. Not as nice as the initial coverage of the $40 copays, also not as bad as the deductible of $505. And we add a new payer in this phase. You are responsible for that 25% of the cost. Your Part D plan is responsible for 5% of the drug cost. And then the drug manufacturer is now responsible for 70% of the drug cost while you're in the coverage gap. Now you've got to be thinking, get me out of here. Donut holes were supposed to be a happy thing, and now we want nothing to do with them. Let's talk about how to get out of the donut hole. Remember the $4,660 threshold that we had to meet in the initial coverage phase to move into the coverage gap? Now there is a new threshold for the coverage gap, and that number in 2023 is $7,400. Now, don't make the mistake of saying, oh, this is easy. It's just $7,400 minus $4,660, and I'm now responsible for $2,740. No. That would make too much sense. That would be too easy. The dollars that went into the initial coverage threshold were all the dollars that you paid as deductibles, copays, or coinsurance, plus the dollars that your Part D plan paid. In the coverage gap, the only dollars going towards that $7,400 threshold number are the dollars that you pay and the dollars that the manufacturer contributes. It does not include the dollars that your insurance company has been contributing, which in this example, over the past 7 months, your Part D plan has paid $3,875, and that amount does not go to your coverage gap threshold. So just the manufacturer dollars and your dollars up to this point. And at this point, you've already contributed $785 through your deductible and your copays. Okay, if you just have brand medications, the estimate for your out-of-pocket costs through the coverage gap is about $3,100, which again includes that $785 that you've already paid through deductibles and copays. We're not the happiest of campers in the coverage gap. Now, if you're just on Xarelto, you're probably not getting out of the coverage gap. But if you're on Xarelto and other high-cost medications, or you're not on Xarelto, but you are on some high-cost medications, once you do hit that threshold of $7,400, life is great, right? Right? Well, it's better, but in 2023 and for the past several years, one of the biggest problems with Part D plans is that there is no maximum out-of-pocket for drug coverage, so you have more coming. Now, this is changing in 2024, so stick with me because I'll go over that in this video. But in 2023, you move out of the coverage gap and into what is called catastrophic coverage. In the catastrophic coverage phase, there are 3 different options, and you unfortunately have to pay whichever one is greater or more expensive. Those options are $4.15 for a generic medication, $10.35 for a brand medication, or 5% of the retail cost of the medication. In our Xarelto example, which is a brand, 5% of $600 is $30, which is higher than the $10.35 for the brand medication, so you would have to pay a $30 copay for the remainder of the year. $30 is our best copay yet, Remember, 4 is the magic number for Part D. There are 4 phases. You've now had 4 different costs for the same medication throughout the year. And in the catastrophic coverage phase, we introduce the 4th payer. You have the 5% responsibility. Your Part D plan is responsible for 15%. And now Medicare takes on 80% of the medication costs while you are in the catastrophic coverage phase. You stay in this phase for the rest of the year until on January 1st, this starts all the way over again, and you are back in the deductible phase of 2024. All right, are you ready for the big changes of 2024? Let's do this. Unfortunately, there are the same 4 phases in 2024, and another unfortunate is that the maximum deductible is going to increase from $505 to $545. And another unfortunate, man, why do I always have to be the one that delivers this? The other unfortunate is that the initial coverage threshold is going to go up from $4,660 to $5,030. Initial coverage works the same. The coverage gap is still around in 2024, and it still works in the same way. I've already delivered a lot of unfortunates. What's one more? The coverage gap is increasing in 2024 from $7,400 to $8,000. I know, Eric, please make it stop. Know that this is not my decision. I wish that I had some say over this, but I do not. But here's the light at the end of that tunnel. In 2024, the catastrophic coverage phase is still there. However, the payers have changed in a good way for you. Your plan pays 20% of the costs. Medicare pays 80% of the costs. You are no longer a payer in the catastrophic coverage phase. Once you meet your coverage gap threshold, that acts as your maximum out-of-pocket. This is actually a huge deal in the Part D world. There is finally a cap, a limit, a maximum on your responsibility for medications. And the Kaiser Family Foundation did a beautiful chart here that shows the impact for people with some of these really high-cost medications. Look at the difference that this change makes on people with these medications. Saving $11,600 a year here, $9,500 here and here, $9,000 a year here, and $8,100 here. There are other examples of drugs where these savings will be significant, and hopefully there are many people across the country who will be able to rest a little bit easier as a result of this change, knowing that there is a maximum on their medication costs. All right, since I like delivering good news way better than bad news, let's wrap up this video with the even more significant changes coming in 2025. To start, there is still a deductible phase, and fortunately, the deductible actually goes down a little bit to $540. It's only $5, but come on. It's better than going up. Once in the initial coverage phase, you'll have copays and coinsurance arrangements, again with your responsibility being a maximum of 25%. Remember, that's the max, likely lower with those copays. The drug plan is responsible for 65% of the costs, and then the drug manufacturers actually find themselves in the initial coverage phase at this point, paying 10% of the cost. You will be in this phase until you personally pay $2,000 out of pocket, which includes your deductible. So technically $1,460 while in the initial coverage phase before you move out of this phase and into, now I want to stress that this is my favorite part of this entire video, and I hope you're ready for this. In 2025, the coverage gap, the donut hole that ruined our love of donut holes, goes away. Once you have paid $2,000 out of pocket, that is your out-of-pocket maximum for Part D starting in 2025. This is amazing news. And by the way, that doesn't include your Part D premiums that you are paying for the plan. That $2,000 is going to be your copays, your coinsurance, and your deductible that you are paying. Once you have met $2,000, you move into the catastrophic coverage phase, but you are no longer a payer in that phase. Your plan pays 60% while in catastrophic coverage. The manufacturers pay 20%. And then Medicare pays the remaining 20%. Whoever made it this far, this is huge news. Now, I do need to bring us all back down to earth a little bit here. Those costs are going to be made up somewhere. The entities involved here in terms of the insurance companies and the drug manufacturers are for-profit entities, and this isn't philanthropy happening here. I can't tell you what other implications this may have because we just don't know yet, but I wouldn't be surprised if the monthly premiums for Part D plans went up. In 2023, the average is about $31.50 per person per month. That may be one area where the costs are shifted. What medications are on formulary, meaning the insurance company agrees to cover them, may change. what tiers medications fall into may change, and the costs of Advantage plans may change. There are a lot of potential things that could happen to try and deal with this dramatic cost difference by implementing a max out of pocket for you. Only time will tell on that. This seems as good a time as ever to ask you to subscribe to our channel, as we will keep you up to date on all of this as it develops. So you made it this far. You are amazing. Thank you for hanging in there with me. I hope that it was worth it. If you learned something from this video, please be sure to like this video. But what would help even more is if you would share this with your friends and family, your social groups who have questions around these topics. One thing related to this topic that you may want to know is how drugs are covered differently between a standalone Part D plan that you would get with a supplement plan and how they're covered on an Advantage plan. I'm working on that video right now, so if you are one of the early birds watching this video, look for this next video in the next week or so. If this video has been released for more than a week, then that other video should be out already. So, all right, I appreciate you. I will see you in the next video.